Your voice, your opinion, your community. Fact TV, free speech, protected.
Hold on, is she in mixed effect going over here? No.
Hello, and welcome to the Art of Being Human. You know, we did spend a little time with the DSM-4, but I'm going to go into it more because it's really important that you understand what this book is all about. I didn't bring it in last time. I had too many things to bring in, but this is the DSM-4. There are, every so often it gets upgraded. It lists, categorizes, discusses every mental illness known to man. And this is the version I have of it. Now, I think there's probably been a major upgrade of it since the pandemic, because a lot of people have mental problems due to the pandemic. And they sometimes call long haulers because they've never really recovered from the illness, or they've recovered but only partially. So I decided that since this DSM is used in the diagnosis and treatment of all mental illnesses and a lot of the physical illnesses that lead to mental illnesses, it's time that I give it kind of a look. So I brought it in. As I said, this is just the 4th edition. Every 2 or 3 years they make another edition, and so this is an older one. But it's all divided in sections. It's very easy to use once you get used to it. You probably never will get used to it. You probably never will be using it yourselves, but it's used by mental health agents, it's used by doctors, it's used by police departments, it's used by anyone that's connected with mental health. There are other systems out there, but this is a system that's used most often is DSM. So this is the book right here, 4th edition, Diagnostic and Statistical Manual of Mental Disorders. That's why we always call it the DSM. Now, it's done in sections, so what I've done is I've separated some of these sections so you'll be able to see. Now, we've been talking about abuse of drugs. There's a whole section in here that has nothing to do except for the drugs and how they're treated. And I want you to, like cannabis, if you look on the upper, this section up here, it'll be different types of abuse with cannabis, and it's all listed out so a practitioner who is treating somebody would be able to figure out the cannabis intoxication, delirium, psychotic disorder with hallucinations, and you can get hallucinations dealing with marijuana, cannabis-induced anxiety disorders. And what I want to do is I'm going to kind of flip through and okay, this is the criteria for panic attacks. Now, I had a lady, when I was a college professor, I was in my office, I was working, and all of a sudden I heard this blood-curdling scream, just like someone was being attacked. And it was a very quiet campus. We didn't have much problem in the campus at all with people who were disoriented or people starting trouble, but she let out a scream like you would not believe. It's like that she was being attacked. So I went ahead and I went out in the hall, classes were in session, and she was just sitting there alone. No one was attacking her, but she was screaming at the top of her lungs. Obviously, she had a panic attack. And so this whole section, if I were to have diagnosed her, deals with panic attacks. And you will notice that there's a section here that's blocked off. I hope you can see that. If there's like a square here and it's all blocked off. And what that is a criteria needed to be diagnosed as having a panic disorder. Well, does she have agoraphobia with it? Does she not have agoraphobia with it? Does she have a mental problem in terms of fear? Does she have a lot of fear? Does she not have much fear? Does it come out of the blue? What does she do to make it better? Can she make it better? And so all of these criteria that are listed that are kind of blocked off are the criteria needed for a patient to be diagnosed as panic disorders. So let me take a better look at that. I didn't see her for counseling, but here are the criteria for the panic attack. You have to have palpitations, pounding heart, or accelerated heart rate, sweating, trembling or shaking. She was doing all of these things. Feelings of choking, chest pain for discomfort. I don't believe she had that. Nausea, abdominal distress, feeling dizzy, feeling lightheaded, derealization. Derealization is a psychological term that you don't feel like you're real. You don't feel like you're in a real environment. It's like everything is kind of fake around you, like you're kind of playing a part in a play. Fear of losing control, fear of dying, numbness and tingling sensations. Now, these are the criteria for a real panic attack. Sometimes they'll list like 10 things, 8 things, and then you have to have like 5 of them to be legitimately diagnosed as criteria for that particular disorder. You know, for panic attack, there are 13 things listed here, and you have to have 10 of them, and those 10 of them that I've read off to you have to last for about 5 to 10 minutes. Then you can be diagnosed as having a real panic attack. I had no question that she was in a panic, but if I was seeing a person, if I was seeing a patient, and a person was in a panic, I might want to review this, although I pretty much know it anyway. How can I be sure that's a panic attack and not something else? Maybe it's a real fear that she's developed over a period of time, and it's not truly a panic attack. Well, you can go by that. This is just checked out for you. You know, here would be a panic attack with agoraphobia, and she did not have any agoraphobia, I was sure of that. But you see how this is all out in a kind of blocked out in a square. You just check that off. So it's really an easy book to use if you can do it, if you know, and you don't get lost in it. And let's see. There's criteria for post-traumatic stress. Now, I have not dealt with post-traumatic stress, but I'm going to. And if you notice, on my right side, this is all blocked off. The criteria necessary to have post-traumatic stress. Now, post-traumatic stress is a very difficult illness to deal with, but these are the criteria that you would look for. If I was treating somebody that I'd never seen before, I would want to check on this to make sure I got everything right. If I am familiar with it enough, and I am familiar with it, I might not need to look at all. If somebody else was diagnosing, I would want to make sure that they had it right, because we would be working together on it, like a doctor or a nurse or something, and you have all of those criteria. Stress disorders are terrible, and what I expect, because of the pandemic, I expect that the stress disorders have taken over, and I expect that there are a lot more of them. What this book would do, what the doctors, there are many, many doctors and many, many medical specialists that work on a book like that. They bring everything up to date. There may be several types of new types of stress disorders due to the pandemic. There be several types of new stress due to the pandemic. People who have lost others, people who are not going to recover, people who want to recover but can't recover. I know that a lot of people who got the pandemic, who got COVID-19, they would be told they were going to get better when it was obvious that they were not going to get better. And I believe a human being would know the difference, whether they were going to get better or not. They could tell. They could tell by their symptoms. And I can remember going from nursing home to nursing home to nursing home to visit people who had stress disorders from the pandemic. And sometimes I wasn't allowed in. I'd have to see them outside because everything was closed up. Now, you can imagine the mental health problems that resulted for people who lost loved ones from the pandemic. You can understand how far they would go to get better. You can understand what their stress levels were, and we're still seeing it today. Now, there is a criteria for pain disorders. How much pain is pain? Now, pain is pain, you know, and you need to have help. with it. But there's a criteria for how serious the pain is and how it's treated. And this is all in this book. So this book is very heavy, by the way. Another reason I don't carry it around much. Pain disorders, how much pain, where the pain is located, how difficult the pain is to manage. There is criteria for adjustment disorders. Adjustment disorders is when you can't adjust to your society. Something is wrong. You can't deal with the people that you need to deal with. You're uncomfortable mixing with other people, and you have an adjustment disorder because you just can't adjust to what's going on in your life. And the criteria to make sure that diagnosis is right is in this area here. I don't think you can see it well enough for me to read it off to you, but that's where it is. There is a list in this book for all mental disorders known to mankind, a whole list of them. Now, it's several pages long. I mean, I'm not going to go into it. It's several pages long, and you go page after page after page after page. It starts with A and goes right down through the alphabet. Every single disease that has to do with mental health care listed, and you can just look it up. There is a glossary in here for technical terms. All the technical terms that are used in medicine that have to do with mental health or illnesses leading to mental health have been defined. So there's several pages. I'm just flipping through several pages for all of those. An alphabetical list of all illnesses and diagnosis and codes, an alphabetical list of the meanings of all of the words that are there and their codes, and you could actually have a code for medical conditions that are induced disorders. Now, an induced disorder is a disorder caused by the fact of drinking or something else, using drugs, and the different mental illnesses occur from that. A whole list of mental illnesses that occur that are induced by alcohol, induced by drug, and it goes on and on and on. And it has a list of all symptoms, all the symptoms that you can imagine. So if you have a patient, if you were a therapist and you had a patient and you were kind of lost, you couldn't figure out what was wrong with them, it lists all the symptoms. This symptom, this symptom, this symptom probably means you have that condition. So every which way there is a way to look. There are other kinds of medications, cardiovascular medications, all of the medications that people take are also listed, discussed, classified, and coded. So you can't go wrong with this book. Now, a lot of people who are not medical people buy this book because they want to tag themselves. They want to find out who they are and what they have. But that's kind of a dangerous game to play. You need to have a therapist. If you're in any kind of hot water, if you're in any kind of illness, you need to have a therapist help you to manage things because you really can't do it on your own. I know that a lot of people might want to see me and they say to me, well, why can't I do this myself? Why can't I get better myself? And how long is it going to take? How long it's going to take is a kind of question that no therapist can answer. It depends upon what they run into. Usually after a session or two, I'm ready to give a what's called a provisional diagnosis. The provisional diagnosis is a diagnosis that you have, if you're a therapist, on the basis of the knowledge that you get. But it's also subject to change. As your knowledge about a person changes and you know more and more, your diagnosis for them might change. So that first provisional diagnosis is a diagnosis that you have based on what you know at the time. And it's also limited because as you get to know a person, it'll be more and more that you know. And you also may up with a dual diagnosis. A dual diagnosis is when you give more than one diagnosis to a person. You may have two diagnoses. You may have three diagnoses. As you know more and more and more, then you can diagnose more accurately. But you start off with that provisional diagnosis. So that tells me something, or that tells you something about the DSM and we use it all the time. Medical professionals use it. So I'm going to close here because our time is coming to a close. We'll continue next time. Thank you for watching. Please join me then.